Welcome to this edition of the Designs for Health audio science article.
Vitamin C's role in type 2 diabetes. People living with chronic conditions often have increased nutrient demands compared to healthy individuals. Under these circumstances, disruptions in metabolic processes underlying inflammation, oxidative stress, or an inability to meet metabolic demands with current nutrient reserves renders certain nutrients conditionally essential. In a study published in 2019 in the journal Diabetes, Obesity and Metabolism, researchers demonstrated that patients who have type 2 diabetes had improved glycemic control and blood pressure after 4 months of supplementation with ascorbic acid, which is a widely used source of vitamin C. Previous research published in the journal Nutrients showed that patients with type 2 diabetes have lower plasma vitamin C levels. Therefore, individuals with a history of prediabetes or diabetes likely have greater vitamin C requirements. This makes sense since insulin resistance is associated with chronic low-grade inflammation. Vitamin C requirements go up in order to mitigate oxidative stress. Other factors may contribute to this as well, such as increased vitamin C excretion in those with microalbuminuria, or competition between glucose and vitamin C for uptake into cells. This study included 31 patients with type 2 diabetes. It was a randomized crossover study in which each patient took 500 milligrams of ascorbic acid twice daily or placebo for a 4-month period. Patients wore glucose monitors for 48 hours and consumed standardized meals pre- and post-supplementation. Measurements and assessments included postprandial glucose, incremental areas under the curve, the duration of the day in which patients were in hyper and hypoglycemic states, an average 24-hour postprandial glucose concentration, hemoglobin A1C, insulin, blood pressure, and oxidative stress. Ascorbic acid supplementation significantly decreased daily postprandial glucose, postprandial hyperglycemia, and time spent in hyperglycemia. In addition, compared to placebo, systolic and diastolic blood pressure decreased an average of 7 millimeters of mercury and 5 millimeters of mercury, respectively. Vitamin C supplementation may be considered in patients with type 2 diabetes to help prevent complications and to support overall health. Earlier research from the European Journal of Clinical Nutrition demonstrated that vitamin C doses over 200 milligrams per day significantly reduce glucose concentrations. Research has also shown that inositol deficiency is common in patients with insulin resistance. There appears to be a reduced ability to process, metabolize, and effectively use inositol from foods, which is a distinctive characteristic feature of insulin resistance. As a result, the nutritional requirements of these patients may not be met by a simple change in the diet. For practitioners, inositol should be considered a conditionally essential nutrient for these individuals. The level of nutrient intake that maintains the best possible health varies greatly among different individuals. Lifestyle choices and environmental exposures filtered through genetic predisposition are fundamental factors in the expression of disease, and a successful treatment approach must include an investigation into all of these factors.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.